Livingstone, a small city in the south of Zambia, is home to one of the seven wonders of the world, the majestic and incomparably breathtaking Mosi Otunya Falls. Translated into English as the smoke that thunders. David Livingstone, whom the city is named after, aptly described the falls. Scenes so lovely must have been gazed upon by angels in their flight. The Zambezi River, which the country is named after, winds in and out of Zambia and climaxes into the beautiful, mesmerizing curtain of water that plunges to a height of 108 meters with a span of 1,708 meters. Being a border town and lying in this region of the world, Livingstone also has its fair share of worrying statistics.
According to a recent case study done by Clinton Health, Sub-Saharan Africa has one of the highest burdens of adolescent pregnancies in the world, with the rate twice the global average at 98 births per 1,000 girls. So nearly 30% of Zambian adolescent girls get pregnant by the age of 18, with the eastern and southern provinces leading in this. Added to this, the findings of the 2022 drug availability, affordability and stock-out study on SRH commodities in Zambia shows that there is a very low availability of SRH commodity, which is only at 36.4%, and this is in public, private and mission health facilities.
Limited access to family planning and information services supported by social, cultural, and structural drivers are key drivers to the scourge of adolescent pregnancies. Even though there are family planning options available, most adolescents are unaware of these services.
So you find in the facility there's a low uptake of these commodities.
In an effort to change this worrying narrative, an EU-funded program running in 6 African countries called Solutions for Supporting Healthy Adolescents and Rights Protection, SHAP, has trained civil society organizations, media, faith actors, youth and women-led organizations in policy advocacy and awareness raising amongst community members in a bid to increase demand and supply of sexual and reproductive health commodities and services for adolescents.
Reproductive is the implementing partner here in Zambia for the SHAP project, which is supporting health adolescents and rights protection. The SHAP project is a program that is designed to improve the health of our adolescents in the sub-region, looking at sexual and reproductive health rights. The design of the program in terms of its objectives is to look at increasing both the supply side, of commodities, looking at availability, accessibility, and affordability of sexual and reproductive health, commodities for our adolescents, and of course the provision of the care, as well as the demand side, which is looking at how these commodities are being utilized by our population, especially adolescents in the facilities.
Maintaining good sexual and reproductive health means people need access to accurate information and to safe, effective, affordable, and acceptable contraception methods. They must be informed and empowered to protect themselves from sexually transmitted infections and, when necessary, receive timely and affordable treatment. And when they decide to have children, women must have access to services that ensure they have a fit pregnancy, safe delivery, and healthy baby. Livingston opinion leaders, made up of faith actors, media actors, and youth actors, came up with an integrated action plan that aims to provide reliable information about adolescent sexual and reproductive health and rights so as to counter stereotypes and fake news. They held a community dialogue at the Church of God on the 22nd of February 2024, where invited members of the public engaged in a frank, no-holds-barred discussion on sexual and reproductive health. The dialogue got underway by having a biblical background to sexual and reproductive health and why the church should be part of this dialogue.
But God, when He created man, part of man is sexuality. So in short, we are saying, many of us as churches, we don't emphasize. We all emphasize spiritual part, we don't emphasize the physical part. When God created sex, He created sex for three reasons. One, for enjoyment by the married people, not the adolescents. We said about it. Number two, we also said God created sex for the continuation of the human race. He said, go and do what? Go and multiply. And many of us, we don't seem to preach that. Because we're not at nice house. The other reason why He created sex was so that we say, we preserve the covenant. Because God made a covenant. And He said, how are those people going to increase?
A young man who listened intently was quick to pose a burning question.
So what do they tell my friend who says I'm sexually active? I want to have sex because if God didn't want me to have sex, He would have given me. He would have given me these feelings of feeling like that. What do they tell someone?
Thank you. There are two things in that. One, the greatest thing that we always tell the young people is to abstain. Okay? To abstain. But if you are found on the other side and you really can't control yourself, then take yourself. If you don't, you might make an STD. Others, if you get HIV/AIDS, it's also another problem.
And it is that age that is critical. Because muntu akakula manje kulivamene aona ngati stifiti na mind yako na kukosa eneo. Muza trust me that abstinence will not be a difficult thing. Two, tena kuziba kuti navamene tifaka mumatupi yatu virengesa kuti matupi yatu develop faster than mwamene afunikira kuchita develop the certain types of food that we give our children or we eat that make them sexually active at a tender age.
Whereas the adolescents in the gathering felt that parents do not offer enough of a listening ear to their needs, the parents countered by stating that it seemed that children preferred to listen more to their peers than they did to their parents. The adolescents responded to this by stating that the issue was that 90% of the time, the nearest form of communication they had with parents was in the form of a monologue, with parents giving commands and instructions. They stated that parents never took time to listen to their children and see things from their point of view, whereas peers gave that listening ear and attention. They went on to pose a few questions that left some parents in the audience scratching their heads.
Cannot be pregnant at a tender age. What information do you have for me? What encouragement can take me to another level? If the partner is you compromise. Yes. But the best thing is not stay. Yes. So in a man's family, because if a man is a way like me, the man is like, quite your right abstinence in your life. But if it's forcing me, I really want to taste. I want to learn. Then I know that condomizing we are many, but it will provide me cervical cancer. What do I do now? Because abstinence is very cancer. Condomizing now, immediately after my problems. What do I do? Immediately after disease. What's the next step forward?
You keep yourself busy and then choose what type of friends you have. If you have peer pressure, it means it will drive you to have sex at the early stage. And the things that you see, avoid them. Most especially the phones, as my fellow parents have mentioned, avoid using these smartphones, are not good for you. Use it accordingly, don't misuse it, otherwise it will mislead you.
I come from that country, so that now tell me now, how can I abstain? Tell me. So now the things for my life, they are like that. Because in yes, that you get a little bit of a kind, natural people, so that now tell me.
Let me across that see abantu abawo so iwe pande kukwati takwaba sisi mkimu so lolo lempa koko
However, Sheikh Yakub Banda went on to put more blame on parents for some of the breakdown in information sharing and best practices for bringing up children.
It is not always that it was Muna, stima wapunzisa wana. But sometimes it's my best challenge kuli was mine. Inebabila nipunzisa mwana. Wakazi wanga wazawa na munga ni very hard kwa mwana. Mwana, wazawa na ni very hard. Chakutine nikachokako wazasala wangu za wakati wako swali. So mwana enge sasa nikonda azakonde babayi bake azaona ati babayi bake ndiye bali mwana pamene muzamuuza kusaiti imwe bazimayi ndiye pamene azamvera. So it's very important that onse ngatidaona ti mwana ana problem tiye tigwirizane wenda ine ndikakhala naye neka pamene muzamuuza ine babayi bake na wetu wafika kumuuza sema paja mwana azaona kasi ni roho.
It is important that as parents and society, we play a more engaged role in providing our children with the right information as regards sexuality. Left to the world, we risk them being misinformed or even disinformed, thereby resulting in a number of negative effects such as early pregnancies, increased maternal mortality, increased STI infections, and a high school dropout rate. A passionate plea was made by Sepiso for parents to give them the listening ear, as there is so much that they want to share with them and learn from them.
We want you to be open. We have a lot of things to talk about. We have a lot of things that we want to learn. But if we find you carry your own, bad after bad you are going to sleep. How can we talk to you? We want you to find time for us. If you've been to Ghana we don't have your encouragement. Depends on my encouragement in the way like that. Depends on my encouragement in the way like that. Because when I say that you catch after my day, I have said that my dad so we need your love, we need your care, we need your time. I have a lot of thousands of questions to ask. I need you to be open. So my fellow parents now, my parents, as you are going home here, I want you to go and practice. Mukafika kuni, have time. Mama ita, mama kabila mama baitana na babu, mama kanisana na wani. So name, baitana na brothers na baitana na sisters. But can't sing like the nani. Not just you are just pumping knowledge. We are just pumping knowledge. Stop and listen. There people what they have to say as well, right? Yeah. So that's all I have to say for today.
As girls and boys struggle to disentangle truth from fiction, fact from propaganda, their trust in all sources of information, from government, academics, journalists, and community leaders, is undermined. We all need to be aware of this to understand the specific adolescent needs and effects of misinformation and disinformation on the younger generation, so we can tailor solutions to meet their needs. The SHARP project, just as its name states, is here to help in finding lasting solutions that will lead to a rise in awareness on SRH issues and implementation of the right policies, ultimately resulting in a higher percentage of adolescents accessing affordable and readily available sexual and reproductive health commodities and services in our country, thereby ensuring healthy lives and promoting well-being for our adolescents and for all.